our specialty, most of the diseases we see, we're by definition a very visual specialty. We look at the eye, that's what you've got. That's how we treat it. Unlike the neurologists, who are almost the opposite, it's all in what the patient is telling us, how they're experiencing it, and that's what's pointing you towards the diagnosis. So I think in terms of the diagnosis and the history, the points, those things haven't changed. And maybe over the last 20 years or so, we've had good criteria for the different types of headache. The International Headache Consortium defines those, and you can look up in a book, if you have X, Y, and Z, this is the most likely kind of headache. But what has really changed that may not be as familiar to the general ophthalmologist, because it's really in the headache clinic and for the neurologists, is the medical treatment of certain kinds of headache, particularly migraine, has been revolutionized over the last 5 to 10 years with GCRP and a group of drugs that have come online that are sort of a step change in the management of migraine. It's similar in the way to, for us in ophthalmology, anti-VEGF treatments were 20 years ago for macular degeneration. And that's maybe one thing that Sam and I are going to try and get across to the general ophthalmologist. If you have patients that are suffering with migraine that are really not doing well, whereas maybe previously there were not that many good treatments, try and get those patients in to see the specialists, the headache specialists, the neurologists, to give them the option to get onto these revolutionary therapies. So that's in terms of treatment, something that's really changed. In terms of management, the other things that have come in the last, I suppose, 5 or more years into neuro-ophthalmology is increased use of OCT, optical coherence tomography, this scanning technique at the back of the eye that we've used for years in the macula and to a degree in the optic nerve as well. We're using that a lot more regularly to track troubles with the nerves, particularly in idiopathic intracranial hypertension, a very specific kind of headache disorder that we see in neuro-ophthalmology. And that would perhaps be the main diagnostic change that's happened in recent years. But I think the take-home point for changes in headache recently have been these new therapies in migraine.